Yes, colleagues, we are unmuting the boardroom, and we are starting right now with this the subsequent session. So perhaps actually I'm going to start by providing a little bit of context around this particular discussion on food allergen management and control. As part of discussions that involved a number of Codex colleagues from the Arab region in preparation for the Codex Committee on Food Labeling, there was a request that was made by representatives of colleagues from the Arab region that more background should be provided around the issue of food allergen management. And this is also because of the fact that food allergen management will be part of an ongoing agenda as part of the Codex Committee on Food Labeling. So because of the ongoing work in this area, what we thought we would do, we would use the opportunity of this symposium and this session in particular to provide you with an overview on food allergen management and control, and then position the activities in Codex within that context. So you're going to indulge me, in fact, with a number, indulge me and us on a number of presentations. We have, in fact, 3 areas of presentations. One where I'm going to be taking probably around 40-45 minutes, give or take, to introduce food allergen management and control. We will have a presentation from our colleague Joseph Touma, speaking about some activities that are specific to the region, and particularly data collection around one allergen of interest to the region, and that's sesame. And then we will have a presentation related to allergen testing that is brought to us by one of the sponsors of this program, and that is the company R Biopharm Diagnostics in Europe. So, attempting to change the slides. Okay, so this is the outline of this first presentation. I'm going to be starting with introducing the current status of allergen standards at the international level and highlighting particularly what was accomplished. I will be introducing some levers of change in this area, and then speaking about perspectives of international guidance and further convergence in allergen management. Now, the food allergy affections, or if you will, the condition of being allergic to food is in fact a condition that contributes to the burden of diseases. And in fact, it's a contributor to public health expenditures, to negative public health impacts. If you even look at this from an economic standpoint, the impact actually is even bigger because food allergen related incidents can translate in emergency room visits, in interruption of work, and a family that has in its midst one individual that is suffering from food allergies, generally actually that condition will be witnessed or felt by all the other members of the family. It doesn't stop to that individual themselves. Now, food allergy incidents in themselves are preventable. Now, even though, again, at this point in time, there isn't, in fact, a cure that has been identified to food allergies, although immune therapies are actually progressing in this area. But once you are allergic for the allergies that cannot be outgrown between childhood and the adult stage, basically this situation is non-curable. And the only thing we can do is really to manage the risks associated with the condition. And the only way to manage the risk is to avoid the food to which the individual is allergic. So avoidance is the most effective way, essentially, to manage the risk for food allergic consumers. And when you look at food recalls, as they are reported by a number of jurisdictions in North America, in Europe, in the Southwest Pacific, so speaking about Australia and New Zealand, when you look at the number of recalls, you will see that actually food allergen related recalls are the highest numbers of recalls witnessed. My slide sorter is not cooperative with me this time. Looking at the impacts here, emergency room visits associated with food allergy incidents. Again, why? Because food allergies can lead, or the incidents can lead to acute reactions, leading potentially to anaphylaxis. Anaphylaxis is really a syndrome that impacts various organs at the same time and can potentially be deadly. So we can die as a result of an anaphylaxis incident. And this is a paper in Canada reporting on an increased number of visits related to anaphylaxis conditions. These are statistics related to food recalls. And again, even though I stopped here the statistics until 2013, it shows you when you compare the numbers of undeclared allergen-related recalls with all the other hazards, food hazards, for most of the years, food allergens are the highest area of food recalls. The only time when you see more recalls or close enough recalls related to microbiological conditions is when you are in a situation, for example, this year in Canada, we had the listeriosis outbreak, and that's why you had a higher number of recalls. But otherwise, it's generally food allergen related recalls that tend to top the list of food recalls in Canada as it is in other countries. The impacts, medical costs, social impacts, and psychological costs. People suffering from a food allergy, you know that when you have a child that is suffering from a food allergy, precautions have to be taken at school vis-a-vis that child, you know, in what can be brought to school. Impacts can be in the social life. You cannot essentially, I mean, for those of us who have had for dinner, you know, members of the family or friends where you have a member that is suffering from that condition, well, you have to be careful about everything. And that can lead also to stigmatization of those individuals. Now, again, going back to the risk management strategy, no cure, prevention of the incidents, and that prevention happens through avoidance of the food where the allergenic ingredient can be present. Now, when you go to a restaurant, you can get that information by asking the person who prepared the food. Hopefully, you can get that information. But when it comes to prepackaged foods, the only source of information about the composition of the food comes from the label. And that's why, in the context of risk management for food allergens, essentially the main strategy is labeling of prepackaged foods. And it is, in fact, the cornerstone of regulatory interventions guided again by what Codex standards came up with. So again, avoidance is the key to prevent those serious health consequences. And consumers depend on the label to have information that is accurate and that provide them with the opportunity to choose or not that food or to select it as suitable to their conditions. Now, generally, if we look at the policy objectives related to labeling of allergens, so using labeling as a risk management measure, basically the label needs to be supporting that avoidance strategy, which means that it needs to be accurate, it needs to be complete. So in the sense that there shouldn't be a hidden source of allergens that is not declared. It should be clear, meaning that you cannot be using scientific language with everybody, you know, to declare ingredients that are of importance. So it has to be simple language and it has to be reliable. After reading the label, I cannot be in doubt as to the composition of the food. Now, labeling, as you know, can be regulated. And in this particular area, basically, most of the labeling requirements at the regulatory level were inspired from Codex guidance. And the first element that Codex guidance focused on was the labeling of ingredients in prepackaged food. So that's essentially those ingredients that are deliberately added in the composition of the food. So trying to change slides. Now, there is a Codex committee that looks after that, as you know, and that's the Codex Committee on Food Labeling. And that committee worked over the years, in fact, to develop guidance. In fact, in 1999, I believe there was a standard that was adopted related to the labeling of priority allergens. I'm going to paraphrase that standard. That standard amounts to the following. When an ingredient known to be a priority allergen, and we will define what a priority allergen is, that ingredient should be subject to mandatory declaration in the list of ingredients of a food label. That's essentially very simple requirement. Now, the question is, what is a priority allergen? And that's what we're going to express, what does that mean in terms of what is a priority allergen? Now, explaining what are the impacts of these changes in policies, or what do you mean by I want to enhance the labeling of priority allergens? Look at this situation. You have a product where in the list of ingredients, you have flour and ovalbumin. When you have the word flour, you don't know, is it corn flour? Is it wheat flour? What is it made of? It's not precise. When I have the word ovalbumin, if I'm not a scientist, how do I know that ovalbumin is in fact an egg protein if I'm allergic to egg? Another element, a number of ingredients are exempt in the regulation of several countries, are exempt from component declaration. Why? Because sometimes they are made of so many components that if you mandate the declaration of everything, you will have meters in the declaration of the ingredient list. So if that ingredient that is made out of so many components has an allergen in it, that's a potential danger for me as an allergic consumer. So the policies that aim to upgrade food allergen management, they intend mostly to address these gaps primarily and to look at how that will translate. In the first case, when you had flour and ovalbumin, if you enhance the labeling following Codex guidance, you can have either wheat mentioned after the word flour, egg mentioned after the word ovalbumin. So here I'm using simple language of these priority allergens by which I have identified these to the consumers that need to know that. Or I will be going to a contains statement and I will be seeing basically contains egg and wheat. That's as simple as that in terms of upgrading or enhancing the labeling requirements to meet the policy objectives of supporting avoidance. Now, this is for the other example. If in your seasoning you have a component that is an allergen, what we need to have is we need to have the declaration of that. We do not actually lift the exemption from everything else. We don't have to declare everything else, like if it contains pepper, salt, whatever it is, we're going to leave that without anything. And the main element is that mustard is declared, or we have a contains mustard. So this is how the policy change should really materialize in this context. Now, in 1999, that standard was developed, and the main question in the standard is, what do we mean by priority allergens? Because technically, any protein has the potential to be allergenic. Okay, kiwi can be allergenic, apples can be allergenic, peach can be allergenic. So which ones should I be focusing on? And the priority of priority allergens was in fact a list developed using a science-based criteria, using in fact data, accounting for epidemiological information, accounting for reaction, the impacts of certain ingredients, looking at the acuteness of the reaction, the prevalence of the allergies, the prevalence of the incidents. And GFA, the Joint Expert Committee on Food Additives, actually worked on this list and worked not only on adopting a list that is known or was known by the list of Big 8, but also developed criteria for countries to adapt that list. And this is accounting for the fact that those lists have to be adapted to the dietary patterns of countries. The allergens for Europe may not be the same allergens for Japan or China, because the dietary patterns are different. And the guidance that was developed, or the guideline that was developed by GFA, could be used, in fact, to or to derive this list of priority allergens by different countries. So now we see the impact of this standard. In fact, when we look historically, most of the countries developed their regulations after that Codex standard was adopted. And I'm going to actually outline the list of these regulations briefly through reviewing the list of priority allergens. For example, in Europe, they took the Codex list and they added crustacean, they added celery, mustard, lupin, and sesame seeds to the list of Codex. In the United States, essentially, it was mostly adopted through the primarily the Big Eight, so essentially the Codex list, and that's included in what is known as the FALCPA law. It's the Food Allergen Labeling and Consumer Protection Act. Now, if we move to Canada, Canada adopted the Codex list, but with some changes. Basically, the list of tree nuts was precised. Rather than saying the word tree nuts, the individual tree nuts were mentioned. Sesame seeds was included. Crustacea was included. Shellfish and mustard were part of the list of priority allergens. If we move now to Asia and the Japanese list contains, in fact, two categories. A mandatory list, mainly eggs, milk, wheat, buckwheat. So you see, this is another allergen that you don't find in the European or the North American list. Peanuts, shrimp, and crab. And you have another list that is actually known as recommended, a recommended list for declaration. So probably of a lower prevalence, of a lower importance in terms of the potential impacts. The second element that is actually worthy to note in Japan is that we do not have, in fact, the use of the may contain statement is not allowed. You cannot use the may contain in Japan, according to the Japanese regulatory requirements. Now, we have seen a number of countries in 20 years, in fact, a number of countries adopted the Codex standards. And we have seen, in fact, countries in Asia adopt allergen labeling regulations, in Latin America. Now, in the Middle East, we do have a list, I believe, that the GSO has adopted for labeling requirements. And that is very much driven from the Codex list. But we do have also some evidence showing prevalence of particular allergens. And this is a paper about food allergy in Lebanon, highlighting, for example, the impact of sesame seed. And in fact, it's compared to peanut in the North American requirement, because basically peanut is one of the most problematic allergens in North America. So this is called the peanut of the Middle East, if you will, in terms of sesame. And we're going to hear, in fact, an update from my colleague Joseph Touma later about the study that was conducted on sesame in some Lebanese products. Now, when we look at the way labeling should be applied, what Codex focused on was mostly the labeling of ingredients. So essentially, the labeling that is managed by a standard and by regulatory requirements is the labeling of ingredients. Ingredients are those products, components that are deliberately added to the composition of the food. What about now the potential for cross-contamination? You are preparing a food and you may be using the same line. So for example, you prepare milk chocolate and then after a while you stop producing milk chocolate and you want to prepare now dark chocolate. The conditions of sanitation of that line generally do not allow you or cannot permit under reasonable economic conditions to get rid entirely of the milk that might have been used in the previous batch. And you will end up with potential for cross-contamination. You may have cross-contamination coming from a number of other activities, mixing of ingredients, contamination in the air, manipulation and handling by workers. How do we manage cross-contamination? Generally, cross-contamination is managed by another type of labeling. I mean, actually, cross-contamination should be managed by good manufacturing practices primarily. And when, despite every effort being made to avoid or to mitigate cross-contamination, the risk of cross-contamination cannot be excluded, we will be, in fact, relying on precautionary statements, potentially, as a means to inform the consumer that despite every effort, this product may not be suitable for you to consume. Because we cannot exclude that peanut or milk or egg is not present there. So this part is a labeling measure, and we will see that this labeling approach is not necessarily regulated in a harmonious way amongst different countries and creates sometimes some issues both for industry and for consumers. Another aspect also that is not covered by a Codex standard for allergens is the use of allergen-free. We're seeing the multiplication of allergen-free statements. By the way, this is not to be mixed with gluten-free, because gluten is not an allergen. It's a different type of reaction. We're not talking about an allergy. We are talking about an intolerance. Yes, an immune-mediated intolerance, but it is not an allergy in the definition of allergies, because it's not an IgE-mediated reaction. Okay.
As lactose.
Lactose also, it's an intolerance. It's not an allergy. So it's not the same, because essentially gluten does not cause death, nor lactose does not cause death. You don't have the syndrome of anaphylaxis that comes with an IgE-mediated reaction, an immunoglobulin E-mediated reaction.
Precautionary can maybe contain.
Yes. The precautionary statement can be, we've seen so many things, may contain, manufactured on the same line as one that uses whatever, may not be suitable for, you see many words actually. And this is, by the way, one of the problems, because many words, sometimes the consumer is lost as to what it means. So there's some effort of better regulating or better managing these statements. So in fact, in this particular case, even though we do have the reliance on precautionary statements, it's actually better to have a precautionary statement, at least I know, rather than to have nothing, right? It's at least a piece of information that I can use that that food is not necessarily suitable for my condition. But the problem is, since the 1990s, when precautionary statements were introduced as a risk management approach, when we look at the way they were used, we're seeing that they are used in a more pervasive way, sometimes without necessarily the proper processes. Some industry, unfortunately, may use that just to put a list and just to actually make sure that I put a may contain for everything. You know, and by the way, this is not necessarily the largest practice, but we can see that, and I will show you examples of some practices in Canada. So this,
maybe it uses to.
Then it becomes exactly. The problem is, because of that, because of the pervasiveness of the use and also the misuse, it becomes in fact an unuseful practice. And in fact, because there is no guidance right now on the management of cross-contamination, no guidance, I mean, that is managed, I mean, until now, actually, I should say, because this was already now addressed by developments, but until very recently, the guidance was very limited on cross-contamination incidents. And this is an example of the practice that we should not have. So this is a product that I picked myself from a store in Canada. Now, a few years back. So it's my poster child of what not to do. Because look at this. This is a barbecue chicken. How many ingredients there are? 2 ingredients. Chicken and salt. You cannot tell me that with chicken and salt, you cannot avoid all the other, you cannot manage to avoid all the others. Look at the may contain statement. This product may have come into contact with eggs, nuts, sesame seeds, sulfites, and seafood. Really? So what does that mean? You know, like for me, you know? So what do I do with this thing? So this is essentially an example of an unuseful precautionary statement. And this is in fact corroborating, this is another one where you have in the list of ingredients, almonds, but here I have may contain traces of nuts. So what is it? Is it an ingredient or traces? Because almond is a nut too. So this is also, this is for me less problematic at least because, okay, it's kind of borderline, it's confusing, but the other one is actually the paramount of not to do. So as a result, this is what happened. In a study that was published in 2007, you see in fact that it was noticed that the more you use precautionary statements, the more basically people are having reactions, because what's happening? They are ignoring the statements. Adolescents right now, when they see that, say, oh, you know what, I ate this product before, not a problem, it should be okay, you know, until basically it's not okay. So essentially this correlated the number of incidents, the number of adverse effects with the frequency of use, in fact, misuse of precautionary labeling. So as a result, in fact, we needed to apply better guidance about this, and better guidance that is risk-based, risk-driven. So using the risk analysis framework in this regard. And here, what is missing is more guidance on how to assess the risk for the potential presence of an allergen resulting from cross-contamination, and how do I use that risk assessment in order to guide my decision as an industry. And part of this is also being able to use data that is available. I mean, this risk assessment is not simple. And by the way, people have been working on this for a number of years, for actually close to 2 decades right now on this particular area. So here, in fact, after some time of work, because you see, Codex worked on allergens until 1999, and then there was no more work on allergens until 2018. So you see, like practically 2 decades that have passed before essentially we picked up the work. And Codex and its advisory bodies, in fact, considered this as a priority, and now we have better guidance that is available. One of the guidance documents that is quite interesting, and this is one of the main achievements of CCFH, a code of practice on allergen management for food business operators was adopted by Codex. And this is, in fact, really, how do I apply that HACCP strategy for this specific hazard that I call allergens? Because it's not a chemical, it's not a bacteria, it's not a virus, it's not a pathogen, it's a different hazard. And it needs to be addressed with specific guidance. So this is what the guidance came up with. That was adopted by CCFH. Also, CCFL, so the Codex Committee on Food Labeling, agreed to have new work. Part of the new work, remember that priority list? Well, that priority list right now is 20 years old. And in fact, actually, there are questions. Soy is part of that priority list. When you look at the number of incidents related to soy, there aren't really many incidents related to soy, and yet actually soy is a headache in labeling, particularly for a may contain statement. Why? Because soy handling generally happens almost in the same way as wheat handling. So you have comminglings of soy and wheat, and you end up using may contain soy, sometimes for no reason. And actually there are no reactions that are noted, even as a result of the potential cross-contamination with soy. So basically, Codex and CCFL triggered scientific advice around the review and the revision of this priority list. And in fact, by the way, the scientific advice was completed. And what I told you about soy, in fact, soy now is recommended for elimination from the list of priority allergens because it did not meet the updated criteria. Okay, we have new information that highlights that. Sesame seed, on the other hand, is meeting those requirements and potentially would be admitted in the priority list. And again, we'll see the importance of this allergen on the Middle East in particular. Also, in terms of the scientific guidance that is looked at, is really the guidance around risk assessment of allergens. How do we use risk assessment methodologies, particularly in the context of food industry management? So more work is happening in this regard, and this is why actually we're bringing this update, because this hopefully will prepare colleagues that are preparing for CCFL to know the context of the agenda items that are still under discussion by CCFL. Now, in this regard, we are not starting from zero, because a lot of partners, and particularly actually industry, has invested heavily on scientific studies to document clinical information related to allergens, and particularly to look at the fact that allergies, food allergy reactions are threshold-based reactions. It means that there is a level that can be considered as safe, and there is a level beyond which you may no longer be safe. How do you establish these thresholds, and how do you use these thresholds in risk management practices? How do you use these thresholds, for example, to decide when you should be applying a precautionary labeling? Because basically, precautionary labeling should be only applied when that risk remains. When the risk is really limited or insignificant, there is no need to add a precautionary labeling for no reason, in fact, because it becomes unuseful. So here we're leveraging the work that was conducted over the years. And in fact, the document that I showed in the earlier slide was developed. It's known by everybody working in the allergy world, the food allergen management world. It's called the Vital Tool. It was developed by the Allergen Bureau in Australia. The Allergen Bureau is in fact a group mainly funded by the food industry sector in Australia and New Zealand. Now, several challenges remain in this regard, which is essentially, we need to make sure that the allergen labeling practices are covered in most of the parts of the world. So I have to say that in the Middle East, other than the GSO standard, but I don't know to what extent it's applied, allergen management practices, particularly for domestic production, are not necessarily a priority. And we're not seeing necessarily a good prevention on this. And probably the next presentation will highlight that. We need to have more tools or better tools to support the implementation of the new requirements. You know that new requirements of food regulations are to apply preventive controls. Preventive controls are to be applicable to all food safety hazards, including allergens. How do you apply that to food allergens? You need better guidance. And now, as I mentioned, the CCFH document will be a great help. And then there's a question. We are, as I mentioned, you know, in North American, European, Southwest Pacific jurisdictions, food recalls related to food allergens are the highest proportion of recalls. Are we actually impacting positively the public health outcomes by doing these recalls? Are we really managing the risk? Are we reducing the emergency room visits? Should we be looking at better strategies of managing allergens rather than only by recalls? Because right now there's a lot of action in this regard. Now, there's a lot of changes that are happening in the context of allergens. I mean, I don't know if you worked with food allergy associations. I can tell you, I had the privilege to work with food allergy associations in Canada. They are the most dedicated and they are the most devoted professional organizations that I have ever seen, because the impact of food allergies can be fatal, and particularly with children. So they tend to be very active in protecting consumers and in protecting their constituencies. And so this issue will not disappear. It's going to be always a priority. Food allergen labeling are a reality and will continue to be implemented across the world. We need now to update the management of food allergens, not only from the labeling of ingredients, but also the management of allergens as a hazard. So in the context of preventive controls, using particularly the CCFH guidance and beyond. So we're looking at new tools, new guidances that will be developed. Also having more clinical information and also looking at immunotherapies. I mean, hopefully one day, food allergies can be cured. There are even actually now some studies that are looking at the impacts of the breastfeeding and the early introduction, for example, of certain ingredients in the diet of an infant as a way to mitigate the appearance of food allergies later in the age. So essentially looking at here cure of this situation. And of course, making sure that there is enhanced level of awareness of the industry in this particular context. So really looking at continued enhanced policies of food allergy incident preventions. Now, my optimistic view for the future is that we will reach at some point risk-based interventions, and hopefully what I showed you, that label, we will never see it anymore, you know, where people apply these generic decisions. We're going to be seeing clinical progress so that we don't have any fatal reactions related to food allergens. We're going to be seeing clearer labeling measures, more educated consumers, also better tools available for risk management by the industry. And we're looking at hopefully the guidance that will come from CCFL in order to improve the guidance around risk-based application of precautionary statements. It's really that element, you know, using that risk assessment to decide if I apply a precautionary statement or I don't. And I highlighted here, for example, this is an excerpt of the CCFH text. You see that there are practically 8 elements that the text is looking after. By the way, for those who are you know, familiar with the HACCP plan, you know, with the prerequisite programs, HACCP preventive controls, it's practically the same thing. You have, you know, elements around the design of the facilities, the control of the operations, the maintenance and sanitation, the training of the personnel. So it's the same pillars. It's just that they are adapted to allergen management specifically. And we're going to be looking, hopefully, at the future, even the use of technologies potentially being applied in managing food allergens. And, you know, we will be moving progressively towards those personalized labels. You know, I could have an application, essentially, that will record my status. I'm allergic to peanut and to hazelnut. And by simply scanning the barcode of the product, the scan of the barcode will tell me this is suitable for me, this is not suitable for me. Of course, in order for that to be accurate, industry has to provide the accurate information related to the production of that particular you know, product. But we could almost reach that level of, you know, ease to access the information for an allergic consumer directly. And this is probably going to be the case. We will have to move in the way we manage food labeling, because right now food purchase practices are no longer by going to the grocery store. I can also purchase food online, and I need to have the information in a different way than simply on the label. So this is going to be still an issue that will continue.
Can you clarify this point about the labeling in the future?
Well,
the man or the consumer who purchased this food, he wants to know that's suitable for him or not.
Yeah.
So the label must have already information that what's the situation of this consumer. Is it right?
Actually, it's not the label that has the information that is related to the situation of the consumer. The label has to have accurate information about the composition of the food in such a way that it can be analyzed by an application that cross-references other information. So the other information is related to my health status. My health status, I don't know, I'm going to take, you know what? I have to use low sodium foods. That's my health status. I am allergic to peanuts. And I don't know, I am actually, I need more calcium. Let's say I need to maximize calcium in my diet, okay? That's my health status. The health status is a different thing. The health status is not on the label. That's in the application. And that's information that is to be analyzed, but it will not be useful unless it is cross-referenced with the information on the label. So the label information is extracted by the application and should be provided by the barcode, and it is cross-referenced with the algorithm that is being used by the application in order to give me a result. Now, by the way, Ustaz Amjad, you are actually futuristic, because you see, I put that in, I put that in 2025, but you know, I think we are very close to that. Interestingly enough, Codex and CCFL examined a discussion paper at the last meeting of CCFL related to the new technological tools and their application in food labeling. So this is the type of guidance that we will have to develop. This is not developed yet. So right now, it's not that these applications don't exist, they do exist, but they are not framed. They are not really, there isn't really a clear guidance around them. So this is what we will be witnessing hopefully in the future. I see this as an area of further regulatory development. Okay, so we'll have more work in this particular area. And I guess there's another element is actually enhancing traceability and actually allowing a better identification of the potential allergen content throughout the supply chain is also another way of helping a better characterization of the allergen content. So this is also another aspect. And for example, using supply chain management tools, blockchains, or other tools, that are out there to document the traceability will be a way to get that. So what we would like to move towards is that information on the label are normalized and trusted using international guidance. This is essentially also, we would not want to see regulations popping here and there with different criteria, because this will be problematic, particularly nowadays where the information travels so quickly, and of course in a globalized environment, not only for food, but also for information and for these type of applications. So we're hoping again that we will maintain the collaboration between the various stakeholders in this regard. And here I really re-emphasize, like in any food safety issue, the collaboration between regulators, of course, guided by the international organization that is Codex, industry, the clinical community, consumer organizations, and academia, basically, hopefully will give us the success towards a harmonious move and progressively improving the practices of allergen management internationally. What we want to do is better protected consumers and an environment for food allergen management that is harmonious around the world, guided by Codex proceedings. And I hope with this now, I brought colleagues in the region, hopefully more up to date as to what concerns the issue of food allergen management. And hopefully in the upcoming discussions of the Codex Committee on Food Labeling, colleagues from the region will be better equipped to participate and contribute to the development of Codex texts. Thank you very much for your attention.